Hello everyone, I am Pastor Philip Johnson. I head up the Patient Coordinator Department for Dr. Rick Sponaugle here at Sponaugle Wellness in Palm Harbor, Florida. Thank you for taking the time to watch this video. We hope that it brings encouragement to you and some hope to you as you get a chance to hear the testimony of someone that maybe has suffered the same things that you've been going through and searching for answers. That's the intent of this video, to give you encouragement, give you an idea of what we do here at Sponaugle Wellness, and we do that by meeting a lot of wonderful people that come to us from all over the United States, Canada, even international patients to come here for their wellness and to be treated for toxicity, whether it's from parasites or environmental toxins. So we want to jump right in here, and young man, why don't you tell us your name?
Jason.
And Jason, where are you from?
I'm from many places, but most recently Southern California, San Diego.
Beautiful. You and I were just talking about the perfect weather that you experience up there. And
yes, it is beautiful in many ways.
But let's just tap in real quickly on the idea that you've many places. So are you a traveler?
Yeah, big time traveler. All over the world, all over the country. Yeah.
Okay. So you could have been exposed to things in lots of different places.
Absolutely, yeah.
Well, let's go back in time a little bit. How old are you now?
37.
37. So have you been dealing with sickness for years, or has it been a shorter term?
I can trace the first symptoms back 7 years, when I first went to a doctor. Pretty casually. I mean, wasn't a big issue in the beginning, just some gut issues, some gastrointestinal stuff. And I, kind of just, it bounced around from minor symptoms to being fine, for several years. Then probably about 3 years ago, it got a little more serious. Okay. And through that time I'd always had, gut issues and, some of the neurological stuff, some of the numbness and tingling in hands and feet here and there. But, the gut issue, really started to take hold about 3 years ago.
Very problematic.
Yeah.
And you were probably trying to treat or do holistic things, or just probably very restricted on what you ate. And
yeah, I mean, in one way, it was good. My parents were chiropractors. They tried to treat me, for a year or so, but it just wasn't enough. Through nutrition and supplements, and even saw a gastroenterologist and did an endoscopy. Never really found anything concrete, besides some inflammation and stuff. Okay. Yeah, just I didn't go through that many doctors. 3 or 4 doctors, and then they found Lyme, and it, just sent me into this whole world of Lyme and toxicity and all that. Yeah.
Well, let's talk about this, because I think this is important. So you've got gut issues. You're trying to seek some help. You're probably doing some, like say, some natural things, just anything that brings comfort to that. And through that, basically all they discover is, I would say, gut lining inflammation type scenario. Had you moved into any kind of leaky gut scenario or anything like that yet?
Yeah, the one I did a functional medicine doctor. He was a gastroenterologist. He pretty much assumes everyone has leaky gut, because I had a lot of food sensitivities. Okay. And so we basically just started treating, like I had, inflammation and leaky gut, and once the Lyme came up, kind of went into 9 weeks antibiotics. Okay. And that's when some of the pain and the burning in my feet really came about. Okay. Yeah, there was 5 days where literally it was painful to walk. Okay. And once I got here, I realized, my doctor in California just wasn't enough. Sponaugle said, you just weren't detoxing properly. Yeah. He got some of the story out in California, but here they got all the story. It's not just about cleaning you out. The detoxing part of it was huge. I just wasn't detoxing properly.
Did you have, and of course we do genetic testing. Yeah. Is there any genetic mutations or hindrances in your genetics? For
I got not for the detoxing part. Yeah, that was okay. Okay. The weaknesses were in the Lyme and mold, genetics, or the lack of the ability to process the neurotoxins. Okay. Which was part of my pain.
Well, I'm not the medical staff, and I always stress that to people here, but you know, even the antibiotics you took, what'd you say, 9 weeks of antibiotics?
I just did 9 weeks and cut it off, yeah.
And of course the burning and the pain, part of that would have been, you know, if there was some free-floating bugs that were not wrapped up in the biofilm, right. The antibiotics may have caused some die-off, and because you weren't detoxing. Yeah. That's such a vital point, and you see that. If you're not detoxing that stuff out, it just stays in the body, you reabsorb it, you just continue to have, I call it Groundhog Day, you relive the same day over again and over again. Yeah. So the detox is so important, and we're going to see the value of detox here. I got some notes here about what we did discover about you as you come in. So primarily you came in for gut pain, you knew you had a diagnosis of Lyme, and we do a lot of testing up front. Kind of tells the whole story. Yeah. Our testing is designed to do more just look at the obvious. You have Lyme disease, but to find out what's been compromised in the body. It always goes to the brain. Were you experiencing any cognitive issues or anxiety or any type of those type symptoms?
You know, not cognitive issues. I mean, the brain fog, luckily I never had. I was able to work full time. Okay. You know, what really hit me hard, you know, was some of the psychological stuff with, you know, anxiety and depression. I mean, that really hit me hard, you know, out of the pain and, you know, all these other, you know, systems that were breaking down, you know, just not extreme depression, but definitely depression and anxiety. And luckily, you know, the one thing my doc in San Diego did put me on was the SAMe, which they obviously do here along with many other things, but still I battled with it. You know, it was definitely, I was out of balance upstairs and in pain in my gut, and I was a mess.
So let me ask that quick question of, you know, we do a neuro test. Was any of the brain chemistry, you use the word out of balance, was your brain chemistry out of balance when you came here?
Somewhat. I mean, not nearly as much as some people, but I had been, you know, working with my doc for 1.5 years, and, you know, with Sammy mainly, and, I mean, really, you know, Dr. Sponaugle and myself, I mean, really believe that, you know, my regimen of nutrition and diet and exercise, I mean, I forced myself to exercise. You know, for all those years, even while I was here, you know, as a, you know, going through treatment here, I mean, I do hot yoga and swimming, and back home I was doing saunas. Okay. And started, you know, I knew innately that I needed to detox, even though my doctor wasn't my doctor was telling me, you know, don't do colonics, you can get hooked on them, and didn't stress the detoxing enough, and with exercise and, you know, colonics, I think that, you know, kept me going.
Extremely important. You know, we detox through our skin, through sweat, we detox through our urine, through our bowels, and it's very important that those things are all aiding to pulling those toxins out of us. And the anxiety that an individual could have, or even depression, even some of the panic attacks, it's important that we understand that not only does Lyme, which scientifically is considered, these are fatty toxins when they enter the body, the mold, the Lyme, the bugs, the brain being only a 3-pound organ, but it's some 60% fat, and these toxins very easily congregate, adhere to that fatty tissue, your myelin, even your optical nerve. These are very fatty parts of your body, and so the brain is usually always compromised to some degree, which results in, you know, some brain fog issues or word recall, memory loss type things, headaches. And so again, a lot of this goes back to being able to detox, pull those things, you know, out of all of that. So our evidence, you already knew you had Lyme, so the evidence was that you had Lyme, probably some evidence of co-infections. Biofilm probably was involved in this, and in fact that's going to play a part of this story, which is, in fact, this is kind of, for those that are watching here, I guess we should say how famous you truly are here in our clinic. We should give you a medal of some sort for breaking records. So setting that story up for those of you that are watching, this is often a miscomponent when people go to doctors and they're misdiagnosed, that, you know, the Lyme disease, and let me just make it more of a broader without getting too technical, but you know, the Lyme is going to create biofilm. Once it enters the body, is going to try to encapsulate itself in, weave a web, cocoon, however you want to call it, it's a biofilm.
Yeah.
And when it does that, it wraps up any other toxins that are near it, whether those are Bartonella, Babesia, Protozoa rheumatica, whether it's Trichothecene or ochratoxin. These are molds, benzene, toluene, anything that's floating around when that biofilm is being formed is going to be kind of wrapped up in that little package. Yeah. You were full of that. All these little surprises that had to happen. So let me help these folks to understand. We do a mold test, and your original mold test coming into us showed you had a little bit of ochratoxin mold, okay. Or I should say ochratoxin, but let me explain it for these folks that ochratoxin and trichothecene, which we're going to talk about, come from mold growth, structural growing mold. The molds such as penicillin can produce the ochratoxin gas. There's an outgassing from the actively growing mold. It produces a gas. We breathe that in. It becomes very toxic to us. You know, what's referred to basically as the black mold typically produces the trichothecene gas. So again, very toxin. We're not talking about I feel like I got a sneeze, or we're not talking about that kind of toxin. We're talking about brain damaging toxin. We're talking about hitting the body, joint pain, muscle pain, destroying, and in your particular case, the gut.
Huge, yeah.
And that's where we've been going on this. He came in primarily for, Jason, for all these years of gut issues. And in spite of your best efforts, it just seemed to be persisting and not going away. Dr. Sponaugle, I've heard him lecture about this on many occasions, how trichothecene will affect the gut lining, inflame the gut lining, even lead to a leaky gut type scenario. It can affect the bladder wall as well and cause what seems like bladder infections taking place. So you had these lower markers, and this is where this is kind of the point we want to make. You had these very low markers of mold when you first came in. Yeah. But, and I don't know what week we would have done it, but we eventually put you into a larger kill, maybe the 3rd week or 4th week.
Yeah. Yeah, I mean, the 2nd and 3rd week we did ALA, and those trichothecene markers, started ratcheting up pretty high. We're getting into 5-10 times the, what's considered positive. So already, pretty high. And then the first day of the triple kill, they literally said there must have been just a huge biofilm explosion, and I hit this marker that was over 800 times what's considered positive. So like you were saying, these toxins just get trapped in the biofilm. Yeah. And this was the missing link that I had studied about and read about here that no one else is doing. And that's why I came here, to work on the biofilms, because I felt that's the root of the infection, the root of the toxicity. And that is really, that's the #1 reason I came here. And it turned out to be, that's where we needed to go.
That's where we needed to go. So in the process of getting you there, and this happens with many of our patients, we have several types of our healing IV therapy that we're going to use. 90% of every patient's treatment is all natural, and that was what you were getting through your IV therapy. But we initially, in most patients, we start out with just detoxification. I like to say we're just trying to grab a hold of any free-floating toxins that may be hanging out in the body. Then we move to a second stage, which you mentioned, where we're able to start pushing toxins out of that fatty tissue. So that's where your mold numbers started going up. Yeah. Now we in turn detox all of that out. We grab a hold of that and get it out of the body. And there's kind of a system to this, is because when you get to the biofilm, if there is evidence of biofilm, there's always a surprise of what's in the biofilm, what's going to come out when we break that up. And we want to get all these other toxins out of the way for that moment of trying to get prepared so that you are not hit with a huge toxin load, which in your case, again, folks, you need to understand this. If I can articulate it, I certainly can't do what the medical staff would do here, but when we're talking about when we did that major kill on you, and you broke through what would have been, I think, 100, Amy said, or your plan of care nurse, Amy, she did a great job with you, 149.66 of tricho. Astronomical. That's 831 times over what would be considered the government allowable limit. When we start measuring tricho, at 0.018.
Right.
If you go up above 0.018, you're positive for tricho, and you're at 149.66. Oh, God. Wow, that's like, you're right, that's the missing link. That's
no, it was.
Now, what's cool, what I want to stress is how effective are our detox trips, and we have heard reports that, you know, our detox trips, the drips we use to detox an individual greatly excel. They're very good at what they do, and your numbers showed that, and I had it wrote down here. So we did the test. You had this 831 times over the government allowable limit. After 10 days of detox, all that mold that you busted loose, all that tricho, and tricho is so lethal, is so damaging to the body, that gas is.
Sponaugle even, you know, described it as a chemical type burn. The thing about my gut pain, you know, all these other diseases and illnesses, they would describe, you know, pain, you know, spiking and inflaming and then going back down. Mine hurt the moment I wake up,
Yeah.
you know, to the moment I went to sleep, before, during, and after I ate. It didn't matter
Perpetual.
what I did.
Yeah.
It was perpetual for years, for 2 or 3 years, you know. So this burn is just this chemical burn from these toxins, yeah.
I want to revisit that, if I can stay on track, and just talk about the detox strips for just a moment. We put you on, so 10 days later, we detoxed you for 10 days. 10 days later, your mold, we did another mold test on you. We went from this 149.66 down to 2.95.
Right.
Literally almost pulling all of that mold out of you in just 10 days. We went ahead and detoxed for, there was 4 more days until the next mold test came in, and now we had you down to, which is what your current level is, 1.01 of that trichothecene, which is incredible. It's when people understand how damaging tricho is, first off, it's incredible that you haven't experienced all the other horrible issues that typically go along with that. When you get toxins out of your body, you start pulling the toxins out that are causing so much issues, the body gets a chance to start healing itself and
finally healing.
Yeah, and repairing itself type thing. So did you ever figure out, I know you said you were a world traveler, have you ever pinpoint where all this mold was coming from?
You know, my life started down here in southern Florida.
Okay.
So, you know, with this, you know, lack of mold genetics, you know, to process the toxins, I mean, you know, Dr. Sponaugle said it probably started in childhood. You know, it's just a gradual buildup. You know, I never had an acute or, you know, allergy type reaction to mold.
Okay.
I never remember having reactions. I never dealt with headaches. I've never had, you know, any, you know, exposure problems I can remember. So I assume it's just a slow build-up from my childhood through to places I've lived, you know, all over California and Florida, and, you know, I don't know, traveling to odd places and, you know, picking up, you know, some of these Lyme and protozoa and, you know, no other proof of anything, but, you know, parasites, of course, they're pulling parasites out of me, and, you know, just the build-up, you know. Yeah.
Could have been a little bit of there, a little bit here, a little bit there.
Yeah.
Structural growing mold, you know, you need basically 3 things. Again, this is not an exhaustive study, but obviously mold spores, which are everywhere in our world, and then of course moisture has to be present, and then you get a food source. It can be anything organic, even something like dust. You start growing mold, structural growing mold. The government, I think numbers are 50% of every structure in America is toxic because of mold. The mold remediated people would tell you it's probably more like 70%, and you get into that environment, breathe in the toxins being produced from the active mold, and some people go down very quickly. It can be the straw that breaks the camel's back, so to speak, and then others, you have a gradual build-up through the years, and probably some of your efforts in detoxing, and chiropractors, I think you said your parents are chiropractors, and chiropractors are awesome people, because in this country, I hear it all the time, they are some of the people that look outside of the box, you know, for other approaches to healing, and I'm sure they were doing you some wonderful things there. Well, this is your exit week. Tomorrow you're leaving here, and probably more than ready to get back home.
Yep. Back to family and work and everything. So
yeah, excited to get back to work again. It's time to do it.
Yeah.
You treated with us for 9 weeks, and probably would benefit staying a little longer.
Yeah.
But time's requiring you to go elsewhere. But you had a lot of things happen and done, even in this short period of time of 9 weeks. And I'm so glad about that. And looking forward to hearing from you again. And I'm sure the doc feels that at this point you can go home and even continue to work on your gut.
Well, and that's part of it. I mean, they really give you the tools here, to feel comfortable going home. I mean, I have so much knowledge. And the tools, the supplements, the detoxing techniques, I mean, I don't plan to come back, but it's good to know that I can come back. And someday I might have to go for one more push to get a little deeper with these biofilms. And, it's...
Well, we've sure pulled a load of that stuff out of you while you've been here.
Yeah, I'm feeling it already. I mean, it's... I get incrementally better every day.
And for those of you that have sat here and observed this, and I hope his story and heartfelt, telling you what he's gone through is meaningful to you. We want you to get better. If you have any questions about Sponaugle Wellness, look for us on the web. You can reach out to myself or one of my other patient coordinators, and we'll be glad to navigate you through your questions concerning us here. Thank you.